Hello, do you hear me? Okay. So we are going to transmit live now. Hopefully you see well. First, we are going to do the upper limb, the axillary area, and then we are going to descend at the level of the arm, cubital fossa, forearm, and then last would be the hand. And then we're going to move on to see the elements which are found at the level of the thorax. If you have any questions, you can put them on the chat, and Dr. Janko is going to answer to them as we go along. If there are any problems, please just ask, and then we can solve all the problems that you have. Okay, so we're going to start in 2 or 3 seconds. So, as you can see here, this is the axillary area. As you know, the axillary area is actually the armpit. So, when discussing about the axilla, we should discuss about its walls. It is more or less pyramidally shaped with the tip cut off. So the tip is actually at this level, the base is at this level. We will have different walls, anterior, posterior, medial, and lateral walls. The anterior wall, which you can see at this level, it is formed by multiple layers. The first layer that I removed was the skin and the subcutaneous tissue. Soon after, we will go for the muscular layers. Now the muscular layer, the first muscle that you see is this white muscle that unites the thorax with the upper limb, and this is called the pectoralis major muscle. Superior to pectoralis major, you have the clavicle. Underneath the clavicle, you have the subclavius muscle. And in between these two muscles, it's a fascia that will be elongated from superior all the way enveloping the pectoralis major and then inferior connecting with the skin. If we remove the pectoralis major, we arrive underneath it, so deep, and we find this muscle. This muscle will unite it here. This is called the pectoralis minor muscle. In between pectoralis minor and subclavius, you have a fascia, which is called the clavipectoral fascia. In between pectoralis minor, its inferior border, and the inferior border of pectoralis major, you have another fascia. This is called the suspensory ligament, keeps in suspense the elements inside the axilla. This fascia, it is also connected to the base of the axilla, all the way till what is called the axillary fascia. The axillary fascia is the one that unites the inferior border of pectoralis major all the way posterior till this muscle. This is the latissimus dorsi, or the wide muscle of the back. So it's quite big. And if we remove the pectoralis minor, then we arrive inside our axilla with all the elements. I colored the elements for you so they would be more visible. In regard with the posterior wall, it is also a wall formed of muscles. The most inferior one is this one, the latissimus dorsi. Then, if we go just a little bit higher, we arrive to another one. This is the teres muscle. You know, we have two of them, teres minor and teres major. This is the teres major. And then we arrive to the scapula itself, which is covered, this surface, it's covered with the subscapularis muscle. So three muscles will form our posterior wall of the axilla. In regard with the medial wall, which is this one, the medial wall, it is formed by the indentations of the serratus anterior muscle. The lateral wall, it is at this level meaning at the level of the humerus. Who is forming our lateral wall? I will just show you in a second. We go all the way at this level, this being the bicipital groove. The bicipital groove with the tendon of biceps brachii muscle, the long tendon of biceps brachii muscle. In regard with its upper opening or superior opening, this one is formed by three elements. Medially, you can hear it. It's the first rib. Then anterior, it's actually the clavicle that I removed. While posterior, here, you can hear it also. It's the superior border of the scapula. While the inferior or the base, it's nothing else but the skin, subcutaneous tissue, and our fascia, the axillary fascia. Now, that being said, we arrive into the axilla, where we can find all these elements inside the axilla. We will find nerves that come from brachial plexus, veins that will be finally drained into the superior vena cava at the end, and arteries that are coming from the subclavian artery. Okay, now let's see a little bit about these elements. What you should know is that everything that is in the axilla goes around the axillary artery. What you can see here inside the axilla with yellow are branches of our brachial plexus. These branches of the brachial plexus are called cords. The name of the cords come from the position that they have all the way around our axillary artery. Okay, so that means we will have a lateral cord, a medial cord, and all the way deep, a posterior cord. So lateral, medial, and posterior cord. We cannot see the trunks because the trunks are higher up here. You can see them because I removed the clavicle. But at the level of the axilla, you will not be able to see them, only higher up. So you can see them here. These are the trunks. You will have a superior, you will have a middle, and you will have an inferior trunk. From the trunks, you have your divisions. You'll have anterior division and posterior divisions. All the posterior divisions will form our posterior cord, while the anterior divisions will be divided, and you will see that all the way. You can see them here. Yeah, how some of them form the lateral cord, while some will form the middle cord. Okay, the ending of these cords, the main endings, are the main nerves that come out of them. Of course, we have also small nerves that come out of them, and we'll see them also. But the main nerves that come out of these cords, we will see them in a second. Okay, now let's see a little bit about these veins that you can see at this level. If I put back my pectoralis major, you will see this superficial vein. This superficial vein, it's nothing else but the cephalic vein. You can see that the cephalic vein has a superficial path right here at the proximal part of the arm. You can see it's in between the pectoralis major and the deltoid muscle. So at the level of the arm, proximally it's in between them, and then it goes all the way deep and drains here. Here, meaning at the level of the, in this case, at the level of the axillary artery. Another superficial vein, you spot it here, is this one. This is the basilic, and this one, it has a medial position, also superficially. You can see that the basilic joins the brachial veins in this case and forms our axillary vein, in which you have the cephalic draining. If we go deeper, then we have our 2, 1 and 2. You can see them all the way here and here. They go and they follow this artery from this spot, because if I put back the pectoralis major, then you can see that this is the limit of the axilla. So from this point on, we have the brachial artery. From this point superior, we have our axillary artery. So from this point on, we have the 2 brachial veins, one side and another. And here in this case, you can see that even inside the axilla, we have 2 veins, 2 axillary veins. Usually we have only one, but in this case we have 2, plus here you have another division that will join and will form our main axillary vein, and then of course the subclavian. In regard with the vessels, the arterial part, we have the axillary artery, and it's this one. Now you know that the axillary artery, because of this muscle, the pectoralis minor, will subdivide, imaginary of course, subdivide our artery into 3 parts. A superior part, a deep part, deep to pectoralis minor, and an inferior part. So we'll have a suprapectoral segment, then we'll have a retropectoral segment, and then infra, or that is inferior pectoral segment. Each of these segments will give up branches. The first one, the suprapectoral, will give one branch, which unfortunately in this case is not visible, and it's called the suprema thoracica, or the superior thoracic. Then the second part is this one, and this is retropectoral, and gives up 2 branches, and you can see them quite nicely here. One, which will go towards the lateral aspect and goes all the way here. It is called the thoracoacromial branch. And then you have the other one, which you can see here, that it actually descends all the way at the level of the thorax, being the lateral thoracic. If we go even more inferior, we arrive to our third segment. Our third segment is the one that gives up 3 branches. And let's try to spot them. It gives up 2 circumflexes, and we can spot them right here. You can see 1 and 2. 2 circumflexes, yeah? Circumflex humeral arteries. These are the circumflex humeral artery. And then another one that was cut, you can see it right here, that goes all the way in the subscapular area. If we go even deeper, but this time we get out of our axilla, we find this one. You can see it here, yeah? This one is the deep brachial. Being the deep brachial, you know that this one has a particular feature. It goes together with the radial nerve. Basically, it goes all the way around the humerus from the medial aspect towards the posterior aspect inside what is called the radial groove. This radial groove, it's located inferior to the insertion of our deltoid muscle, which you can see here. This is the big deltoid muscle. Okay, in regard with our nerves, the nerves that can be seen at this level, the major nerves are these ones. So, from the lateral cord, we have this main nerve. This is called the musculocutaneous nerve. Musculocutaneous nerve pierces this muscle here, this one. You can see how it goes through it. This is the coracobrachialis muscle. The coracobrachialis muscle goes together with the head, short head of the biceps, and inserts all the way superior here, coracoid process. Okay, so this one pierces the muscle, the coracobrachialis, and then we can re-spot it. Just a second to tip away our superficial vessels. So we can re-spot it here. This one being located in between our biceps and our brachialis muscle. And you can see quite nicely how it gives up muscular branches, because musculocutaneous gives up motor supply for the muscles of anterior compartment of the arm. Then, as soon as he leaves from underneath, the biceps becomes superficial and will innervate the skin at the level of the forearm. We move along and we go towards our medial cord. This is our medial cord. The medial cord gives up three main branches. One that is most medial located is this one, and it's called the medial cutaneous of the arm. And you can see how it innervates the subcutaneous tissue at the level of the medial surface of the arm. The other one that follows soon after is this one. This one is called the medial cutaneous, from subcutaneous tissues of sensory innervation of the forearm. This one descends all the way, and then you can see here at the level of the forearm how it gives up branches in order to be able to innervate the skin at the level of the forearm. So this is the medial cutaneous of the forearm. The other one is this one. This one, it's nothing else but our ulnar nerve. The ulnar nerve, it's a nerve that goes on the medial aspect of the arm, and then as soon as we go to the distal part of the arm, we lose it, because its path will go posterior, you can hear it, to the medial epicondyle of the humerus. This is the ulnar nerve. And then, of course, we will re-spot it at the level of the forearm. Last but not the least, we have our posterior cord. This is the posterior cord. The posterior cord gives up two main branches. The one that leaves quite soon after, which is this one, and it's the axillary nerve. The axillary nerve travels along with our circumflex arteries. You can see them here, 1 and 2, anterior and posterior. Actually, it travels with posterior circumflex, and you can see that the posterior circumflex, it's a little bit bigger in size than the anterior circumflex. So it travels along here, and then we go just a little bit more inferior, and we can spot this nerve. This nerve, it's the radial nerve. Let's move along all these nerves so we can spot it much better. It's this one, the radial nerve. The radial nerve descends, and then here it goes together with this artery. Just let me take it off so you can see it. Oops. With this artery, you can see how they go together. Yeah, this is the deep brachial. So radial nerve and deep brachial. Perfect. And then our radial nerve, after going inside the radial groove, curls around the arm, and we can re-spot it here. This is our radial nerve. The radial nerve at this level, at the distal part of the arm, it's located in between brachialis. Keep in mind, this is biceps, this is brachialis, and this muscle here. This muscle being nothing else but our brachioradialis muscle. So this is our radial nerve. The radial nerve gives up also branches at the level of the arm. Let's take our musculocutaneous. It gives up this branch. This branch is actually the cutaneous, lateral cutaneous branch of the arm, and I will just try to move it just a little bit, but you will not spot it that well. But it also gives up a posterior branch, also cutaneous. Okay, so this was about the vascular part and innervation. In regard with the muscles, we already said, but I will just repeat them. So we will have our pectoralis major, our pectoralis minor, the deltoid. Let's move the superficial part. Okay, our biceps brachii, two heads, long, short, different insertions. Coracobrachialis muscle, deep, it's the brachialis muscle, and then underneath on the posterior aspect, so here, but you are not able to see it, it's only one muscle, and that one is called the triceps brachii. So anterior biceps brachii, posterior triceps brachialis muscle. Okay, we move along just a little bit, so we go at the level of the cubital fossa. Let's arrange back our elements so we are able to see them better. So this is the cubital fossa, like this, in between my arms, yeah? Like this. Okay, how and which are the limits? If we go and we spot our two epicondyles, the superior border, it's the transverse plane that goes all the way superior to the two epicondyles. It is more or less a triangular shape. The medial border is formed by this muscle, which is called pronator. You have it here. Pronator teres. The lateral border is formed by this muscle, brachioradialis, and you see it forms more or less a triangular at this level. Deep into the cubital fossa, we will have, and you can see it quite nicely, the tendon of the biceps, which, what does it do? It divides our fossa into a medial compartment and into a lateral compartment. Deep to this muscle, we have our aponeurosis of our biceps brachii muscle. So the floor, it's actually done by the aponeurosis of the biceps brachii muscle. In regard with our medial compartment, you can see here elements. Keep in mind, please, that from this point on, it was quite difficult for me to actually spot and stain the veins. So whatever you see red, you should also imagine there is also blue, because at the level of the upper and lower limb, the arteries will be joined by two veins, position one side and another. So here it's nothing else but our brachial artery. Yeah, I forgot to tell you something. Sorry, it's this nerve. It's the median nerve. The median nerve, it is formed, you can see it here, by the junction in between a lateral branch, it's here, from the lateral cord, you can see it here, this is the lateral cord, and then here I will have a medial branch. This medial branch is coming from the medial cord, and together they will form the median nerve. At the superior part, proximal part of the arm, the median nerve is located like this, and this would be lateral to our brachial artery. As it descends, it will move just a tiny bit across our artery and will position itself at the level of the cubital fossa in a medial position. So proximal arm laterally, as we move along towards the cubital fossa, it will be positioned medial. And here we have our median nerve, followed laterally by our brachial artery in the medial compartment of our cubital fossa. At this level, you would see that the median nerve give up branches. You can see them all the way here, the interosseous. And then our artery divides into a more superficial branch, which is our radial, and it's laterally located, and into another one, this one. This is the ulnar artery, which will go medial. This ulnar artery, you can see that in this case, this is a quite particular case, divides into this branch, and let me show it to you, into this branch, which is called the median branch because it will go together with the median nerve, and you can see them here, 1 and 2. And another branch, the interosseous, is this one, which goes together with our nerve. Of course, the ulnar, you can see it here, as I told you, it will go deep and towards the medial aspect to meet the ulnar nerve. If we go back to our cubital fossa, just a tiny bit so we can fix the camera, okay? If we go back to our cubital fossa, then here we will have our radial nerve. So the radial nerve is the one that rests in our lateral compartment of the cubital fossa. The radial nerve spreads around and gives branches. You can see this one, which is a little bit more superficial, but then soon after goes deep to our brachioradialis, and the other deep branches. You can see them here, which will lose their path inside the muscles. Okay, so this was our cubital fossa. We go along and we move at the level of the forearm. When we move at the level of the forearm, first we have to see the muscles. Muscles will be located in layers. So we'll have our superficial layer, which would be done by, you can see it here, brachioradialis. Be careful because in some books, the compartments of the forearm are actually different. So you will have lateral compartment, which will be done basically by the brachioradialis, while in some books you will have only anterior and posterior compartments. That being said, in the books which you have only the anterior compartment, the brachioradialis is positioned in this one, in the anterior compartment. So we'll have our brachioradialis muscle. We will have our pronator teres muscle. Then, soon after it is this one. You look at its path. Yeah, this is the flexor carpi radialis muscle. Followed on the lateral side, you can see it right here, by this muscle. This is called, you can see how long tendon it has. This is called palmaris longus and ends into an aponeurosis, into a palmar aponeurosis, all the way till the level of the palm. And then last but not the least, we have our last muscle, which is most medially located, that one being this one, and this is the flexor carpi ulnaris muscle. If we go even deeper, then we have some other elements. We have vascular and nervous elements, and this being said, we have our median nerve. The median nerve, together with the median artery, travel in between two muscles. So I will remove my flexor carpi radialis, and I will arrive to this muscle, to this big muscle, which is flexor digitorum superficialis. And you will see here how it spreads out into more tendons. Here you saw this one, which was the flexor carpi ulnaris muscle. What do you see? In between flexor digitorum superficialis and flexor carpi ulnaris, you have this nerve and this artery. These are nothing else but the ulnar nerve and the ulnar artery. This is why the ulnar nerve at this level will give motor innervation for both, you have it here, flexor carpi ulnaris, and then deeper here, you can see this muscle, which is even deeper. This is flexor digitorum profundum. So it gives innervation for flexor carpi ulnaris and for the medial part of the flexor digitorum profundus. While flexor digitorum superficialis, palmaris, flexor carpi radialis, pronator teres, part of the brachioradialis, it's given up by the motor innervation by our median nerve. If we go even deeper, you can see it here. Yeah. Oops, sorry. Let's move that just a tiny bit. You can see this muscle. It's flexor of the pollicis. If we move all this aside, deep to them, the deepest actually, it's a quadrangularly shaped muscle. This is called the pronator quadratus. This was the pronator teres. This is the pronator quadratus. So pronator teres is in the proximal part of the forearm, while pronator quadratus is on the distal part of the forearm. You can see a quite distinct feature here, distally. This is the radial artery. The radial artery, you can see that it's located in between two tendons. The medial tendon, it's the tendon of the flexor carpi radialis, while the lateral tendon, it's this one, and it's the tendon of the brachioradialis. This place here is the place where you can actually feel the pulse of our radial artery. Moving along, we said that we have this palmar aponeurosis of the palmaris longus. Then, if we move this aside, you can see these two bands, 1 and 2. These were united, and they were forming what was called the flexor retinaculum. The flexor retinaculum stretches up like a fibrous band and covers all these tendons and all these nervous and vascular structures. Here on the medial side, you can see that who are left behind? Our ulnar artery and ulnar nerve. So the ulnar artery and ulnar nerve don't go underneath our flexor retinaculum, but actually goes superficial to it. Here, by the tension that is given at this level, this is called the carpal tunnel, you can press the median nerve, and then here it's called the carpal tunnel syndrome because of the pressure that is given onto the median nerve. If we go at the level of the hand, we have three distinct areas. The area which will correspond to the polyches, which is called the thenar area. The area which is at the level of the small finger, which is called the hypo from small, hypothenar area, and the area which is located right in between, or the middle area. At the level of the middle area, you will have, in regard with muscles, you can see here, you have the lumbricals, one side and another. And another thing that you can see would be the tendons of our superficial and deep flexors of the digits. You can see this one are for the superficial, and if we go along with it, just with one, you can see it here. What does it do? It splits. It splits at this level, while the tendon of the deep goes in between the splitting of the superficial and inserts all the way to the distal phalanges. Here you can also see the division that are done from the part of the median nerve and of the arteries. Normally at this level you will find an arch, a vascular arch, arterial arch, that would be formed in between vessels given from the radial and from the ulnar. Because in this case we have a quite big median artery, you can see that the arch, it's actually the superficial palmar arch, it's actually missing. Same thing goes for the deep one. So here we don't have any arch. Normally we should have had one located in between them. Okay, so this was about the upper limb that I wanted to tell you about. We will go in a few seconds all the way towards the thorax and see some structures located at that level. So we'll just prep a little bit the thorax, and then we can go and see what we actually have inside of the thorax. Let's see. Dacă ridicăm și punem aici. Okay, let's see, because we have some questions. Do we know why the ulnar artery and ulnar nerve don't mess? We don't know why they do that, but actually that's the path that they have. So no, we don't. At least I don't know the exact things. Okay, let me try to fix the camera so you would be able to see much better for the thorax. Ioana, dacă poți să o tragi de așa. Okay, we can put it like... Just me. Can you reconnect? Okay, let's move this one just a little bit. Okay. I think, or even further. Like, yeah. Okay, let's try to see. Este că o să trească să o faci și din lateral. Las cum mai mișcă. O să trească să o faci și din lateral, știi, când de structurile.
Nu mai, lasă să mă descurc.
Ia să vedem.
E ok. Și mai mișcă.
Stă? Okay, let me put the heart back in so you will be able to see how the heart was located, where the heart, was located. Okay, one side and the other. So. Okay. So normally this was the position of the heart. Just move it up. Yep. Okay. So what you can see here, it's basically the heart, which is enveloped in this structure, which is nothing else but the pericardium. This is the pericardium. This is the fibrous part of the pericardium. And you can see how it covers the heart, enveloping it, exactly like being located inside the sac. Yeah. So if we remove, and the heart, you know that when we look inside the thorax, here the two empty spaces are nothing else but the spaces for the lungs. So what we have in between the lungs are nothing else but the mediastinum. The mediastinum, it's redivided first into two, the superior and the inferior mediastinum. Now, who is giving the division? If I put back the sternum, yeah, here you will have the Lewis angle. The Lewis angle, it's the limit, the anterior limit of the superior and inferior mediastinum. If I go posterior and I remove it, then the posterior limit, it's the inferior border of thoracic vertebra number 4. So basically it's a transverse plane. The superior border is this one, and it's nothing else but the thoracic aperture. And then inferior is nothing else but you can see it here, is the diaphragm, the dome of the diaphragm. And what you can see here quite nicely, it's basically the insertion where the pericardium was. Everything that is anterior to the anterior surface of the heart, and of course located in between the two lungs, it's the anterior mediastinum. The heart with the structures that are coming out or into it, plus you can see them here, one, and on the other side, this one. These are called the phrenic nerves, and before dissection, they were actually attached to the pericardial sac. So these structures will be located in the middle mediastinum. What is posterior to the posterior surface of the heart, it's actually the posterior mediastinum. Okay, now let's try to see a little bit of the structures that we can find into this mediastinum. So we can spot, and I will just show you. You can spot here, they were cut because I took out the costal ribs. You can see here, and then on this side here. These are the two bundles, internal thoracic artery and vein. So they were cut, they were attached posterior to the costal cartilages. I cut them off because I removed the costal cartilage. Okay, we'll just move them a little bit aside. What else can we find into this anterior mediastinum? Well, we can find fat tissue. We can also have lymph nodes, yeah, at this level. If we go even deeper, then we can spot our heart. The heart is the main feature of our medial mediastinum or middle mediastinum. And what you can see here are the structures that are together with the heart. You can see quite nicely here the opening here would be the aorta. Yeah, this is the ascending aorta. Then here it's nothing else but this is the pulmonary trunk that you see. And then you have the two pulmonary arteries. Then, if we move towards the posterior aspect, here you will have the superior vena cava, while here inferior, just let me remove the pericardium, yeah, you will have the inferior vena cava. While on both sides, here, here, and here you can see best, going inside the atria, are nothing else but the pulmonary veins, the 4 pulmonary veins, yeah? 2 on each side. This is 1, 2, then we have 3, and here we go for the 4th. Attached to the heart, you saw the 2 phrenic nerves, this one, and you can see that they go all the way to the diaphragm in order to innervate the diaphragm. These are also part of the middle mediastinum. Okay, now let's see just a little bit what goes posterior, and I will just show you the features that are there. You can see here the opening inside the thorax of the inferior vena cava, while superior here is the opening of the superior vena cava. So this is the superior vena cava. You can see how the superior vena cava, it is formed, you can see here, this is the subscapularis, and then here, or better yet, you can see them here, yeah? You see the jugular, the subscapularis, internal jugular, external jugular, and then they will form what it's called here, the brachiocephalic veins. You have one on the left side and one on the right side. So these veins form our brachiocephalic. The 2 brachiocephalics will join and will form our superior vena cava. Another quite important vessel that drains here is this one. This is called the azygos vein. The azygos vein, just remove them a little bit, the other structures. Okay, you can see it here. This is the azygos vein. You can see how the azygos vein has an ascending path all the way from the abdomen, being positioned a little bit towards the right side. This is the vertebral column, all the way draining inside our superior vena cava. What you can also see here are the veins, the intercostal veins, which are part of the intercostal bundles, because what you can spot also here would be our arteries. The arteries that will drain, of course, at the level of the aorta. And what you can also see are the intercostal nerves that will come out of this structure here. This structure being nothing else, sorry, not this one, being nothing else but the sympathetic chain. Okay, so this was with the veins. Then, another thing that we can spot, it's this one. This is the trachea. The trachea at the level of T4, so corresponding posterior to T4, it will split. It will split into 2 main bronchi. These 2 main bronchi will go for the lungs, left and right lung. In regard with our arterial part, this is our aorta. Into the superior mediastinum, so you can see here the limit, yeah? Into the superior mediastinum, we have the aortic arch, and then you can see that the aortic arch gives up 3 main branches. This one, which is quite big, and it's called the brachiocephalic artery, you can see it here. This one re-splits into the common carotid, of course, the right common carotid and the right subclavian. And then if we move along just a little bit more further, we see 2 more branches, a little bit smaller inside. First one would be the left common carotid, and then last but not the least, the last branch from the aortic arch would be the left subclavian. Then, inside the posterior mediastinum, we have the descending thoracic aorta this time, that you can see quite nicely here, how it gives up different branches, intercostal branches, that they continue all the way one side, and I will just show them to you to see that they also have, you can see them here, they also go on the other side. What you can see here, right inferior with blue, it's nothing else but the hemiazygos vein. The hemiazygos vein, you can see that it goes just a little bit tinier, superior than the dome of the diaphragm. The hemiazygos vein, let me remove just a tiny, our aorta. Okay, you can see that the hemiazygos vein drains inside what we said, it was the azygos vein. So hemiazygos vein here, if you drains into the azygos vein, and you can see it here, hemiazygos, and this is the azygos. Of course, you can also see here the intercostal ones. And here is nothing else but our sympathetic nervous chain. If we remove the aorta towards the left, we can spot this structure, which is located in between the aorta and this thing, which is, you can see here, it's a muscular thing. This is nothing else but the esophagus. The esophagus will remove it towards the right, aorta towards the left, and we see this structure. This is nothing else but the thoracic duct. So this is the thoracic duct. One side, and you can see it here, and another of our esophagus, quite nicely seen, you can see how they branch out, are the two vagus nerve, the right and the left vagus nerve. Now, the left one will go all the way here. It is not that visible, but what you should know is actually that the right one goes here, you can see, and it's good, goes posterior and will form what it's called the posterior esophageal plexus, while the left one will go anterior to the esophagus, forming the anterior esophageal plexus. Here, superiorly, but here, unfortunately, it's not, was cut, should have been a nerve that would have gone like this, circling around the aortic arch, would have been the left recurrent laryngeal nerve. The left recurrent laryngeal nerve, it is a nerve that is located in the superior mediastinum. Be very careful, because the right one, it's not part of the mediastinum, because it is located a little bit superior than the left one. Another thing that I would like to show you would be from this one, from the thoracic parasympathetic chain, you have this nerve here coming out of it. And you can see that it goes all the way deep into the diaphragm. And if we would have dissected the abdomen, it would have gone into the abdomen. This is the greater splanchnic nerve. Splanchnic means organs. This is the greater splanchnic nerve. Okay, let me just see if we have missed something. Okay, hopefully not. I will just show them to you once again. You can see here the branches, venous, arterial, and nervous branches. Hemiazygos on the left side, azygos on the right side, covered by the aorta. Esophagus with the two vagal nerves, right and left, forming the posterior and anterior plexuses. Posterior is formed by the from the right one, while the anterior is formed from the left one. Then the thoracic duct that you can spot in between them. The aortic arch, of course, with the three main branches going from right towards left. The brachiocephalic, you can see it here, common carotid left, subclavian left. Here should have been our recurrent laryngeal nerve, the left one, the two phrenic nerves, the trachea together with the bifurcation into the two main bronchi, inferior vena cava, superior vena cava, with the drainage of the azygos vein into it, the superior vena cava, which is formed by the two brachiocephalic veins, then we have the two, and let me put them back. You can see them here once, and where are you? Here. The two internal thoracics, yeah, vein and artery. And then, of course, our brachiocephalic veins, which will be formed by the subclavian and by the jugular ones. Okay, and don't forget about the diaphragm and the insertion at this level of the pericardial sac. Okay, guys, let me see if there are any chat. Be able to see the video after the live section is over. I don't know, because this is the first time I'm doing a live. Hopefully, yes, I think so. Okay. Can show us the, oh God, the cervicothoracic. Nah, this is actually higher up. Sorry, but no, that's not visible, unfortunately. Okay, guys. So that was it. Thank you very much. Hopefully it was helpful for you. I will see if I will be able to do another one, if this one was okay, about the heart and about the lungs, but that was going to be only how can we spot the difference between the hemiazygos? Okay, so the hemiazygos, it is, let me show you back, just let me put my gloves back. Here, unfortunately, we do not have an accessory hemiazygos and the left costal, subcostal actually vein. That's why I did not show it to you, but I will show you at least where it should have been. So, this is the hemiazygos, and here, superior to it, at this level, should have been the accessory hemiazygos, but instead we don't have it. You can see that it's basically a space without a big vein in it. Here was the place for the accessory hemiazygos. So accessory hemiazygos is missing, should have been here, and the hemiazygos itself is this one, which drains posterior to the descending aorta all the way into the azygos vein. Instead here, just let me show you, you have a quite big, let me remove them just a tiny, okay, so you can see here, yeah, two big veins on the right side. This one actually should have been on the left, but in this case are on the right side. Now, more or less, this one is positioned where the accessory hemiazygos should have been. You don't have a communication at this level from the left side. So that's where the accessory hemiazygos should have been. Okay. I think as veins roles is to carry from the body to the heart. Why are they thinner from arteries and veins be thicker in opposite to the gravity force? Actually, veins have inside of them what they are called valves. Yeah, and what they are doing, you should think of the veins because they are, some are from the superior part and they are using the gravity, yeah, while the ones which are inferior are using actually the contraction of the muscles to push the blood inside of them higher and higher. Plus, because of their valves that are located inside, the blood cannot go lower than it was actually pushed. Of course, we can have what they are called incompetent valves. These valves actually don't work properly. That's why we have, some of us have what they are called varix at the level of the lower limb and never at the level of the upper part of the body. Yeah, at the upper part of the body, we do not have this varix done by the superficial veins because of the distension of the superficial veins. Okay, so I can see that there are no more questions. Thank you all for coming, and hopefully the image was as it should have been. Sorry if it was not as good as I thought it would be, but hopefully it was okay. Okay, thank you very much for being these late hours with us, and I wish you all the best and marvelous holidays. Keep safe and keep healthy. Thank you, guys.